So in this video we're going to be talking about all things cesarean section. So if you're watching this video, maybe you're considering having a cesarean section, maybe you have been scheduled for a cesarean section, and probably you are scared and you want to know everything about cesarean section. Welcome back to my channel. My name is Agos. I have had 3 cesarean sections. I recently had a baby, and of course it was also via cesarean section, and so my experience is still fresh. So I'm going to be sharing some things that you're going to expect before, during and after a cesarean section. So the first thing that's going to happen to you when you get to the hospital is they're going to prep you for the surgery. The doctor is going to give you an IV line. So this IV line is to start hydration. So basically they're going to give you normal saline. Normal saline is water and salt, and this is going to help with hydration. You want to be really hydrated for this procedure because a cesarean section and spinal and everything, the whole procedure can actually lower your blood pressure, and so to offset the potential of lowering your blood pressure, you would want to be very hydrated. And so the first thing is that you'll be given an IV line that will help with hydration. So next is for your anesthesiologist to come in. So I want to explain that for this procedure, 2 kinds of doctors may be in the theater. The first doctor will be the actual surgeon who would do the actual surgery, or actual procedure of bringing out your baby, and the second type of doctor that will be there is the anesthesiologist. So anesthesiologist is the one that is going to help with whether you're going to go through general anesthesia or you're going to be using a spinal. So at this point, the anesthesiologist is going to come in to do a history and physical examination. They're going to ask you your age, your health condition, just general things about you, and this will help them to determine any kind of risk that will be particular to you. So the next thing that's going to happen after this is that they're going to check your blood pressure, check your heart rate, check your vital signs, and be sure that everything is okay just before the procedure. And at this point, they wheel you into the theater and they hook you up to the monitor. The monitor, of course, measures or checks your blood pressure and your heart rate. Next is that they start cleaning your back and they start getting you ready for the actual pinch. By pinch, I mean the actual epidural. So if you're going to get an epidural or if you're going to get a spinal, this is when they start cleaning your back to get you ready for that. Once your back is cleaned, first they're going to give you an injection called Lidocaine or Lidocaine. So Lidocaine is basically a local anesthesia. They're going to give you that injection first, which is going to numb that area before the epidural or the spinal is actually administered. So once that is done, you start to feel a tingling sensation on your legs. This tingling sensation starts to spread up towards your chest, and the next thing you know, you're numb from your chest down. I know at this point this can be a very crazy sensation, especially if this is your first time. It was really crazy for me because it's just like literally you cannot move your legs, you cannot do anything. You want to move your legs, but your legs at this point feel so heavy. They feel like somebody is sitting on your legs and you just cannot move it. Your brain is telling you to move your legs, but your legs are just not cooperating. So if this happens to you, it is absolutely normal and absolutely expected. That is what the injection is for. So just remain calm at this point and don't panic. So once the numbness is established, the surgery proper will actually start. They're going to test to be sure that you don't feel pain. Most of the time, you're going to have your loved one or the doctor or the anesthesiologist try to distract you while they're doing all this. For me, in my own case, I was still very scared. I was still trying to tell them to, take things easy with me, as that was my first time getting a spinal, and I didn't even know that I had already started the procedure. So most of the time, they test for pain, to test to see if you're feeling pain and all that, and most of the time you're not even aware when they do this. And once the numbness is established, they cut you open and actually start the process of the birth of your baby. The next thing that could happen is maybe or maybe not, you may feel a tightening on your chest, especially when the procedure has already started. For me, I felt that, and the doctor was like, everything is pretty normal. But if you do feel that, please don't hesitate to tell them. Don't hesitate to tell them anything at all that you feel you're feeling. whether you think is weird or not. So for me, at some point I felt a little tightening on my chest, and of course I told them that I was feeling my chest tighten, that I couldn't breathe very well, and so they brought in oxygen for me, and I was on oxygen for the rest of the procedure. So if you feel anything like that, don't hesitate to inform your anesthesiologist, and they're going to definitely do the needful. Bringing out the baby is actually not a problem. Within 3 to 5 minutes of into the procedure, the baby is already out. Once baby is brought out, baby is handed over to the nurses or the midwife or somebody that's supposed to take care of the baby, and the baby is baby is taken care of. They start to clean up the baby, start to check the baby to be sure that everything is okay with the baby, and of course the surgery continues. So once baby is out, they start to stitch you up. That is where the bulk of the time goes into. Let me put it that way. That is where the bulk of the time goes into. From the start to the finish of the whole procedure is about between 30 to 45 minutes, and about more than 2/3 of the time was used for stitching me up. That is how much time they spend on stitching you up. So yeah, once the baby is out, I'm sure at this point you start to feel a little bit calm. For me, I started to feel a little bit calm. I wasn't scared as I was before the procedure started. Once the baby came out, I was really calm. I was just waiting for them to just stitch me up so that I could meet my baby. Depending on the hospital, they can clean up the baby and bring the baby to you so that you can at least see your child, touch your baby, have a skin to skin and all that. But of course, it's all about preference. If you do not want to meet your child at that time, probably because you're still very tensed up or you're still very anxious, they will understand that, and somebody else will definitely take care of the baby. So when they're done stitching you up, they lift you out of the theater bed onto a crane, and then they take you into your recovery room. Your family members who are waiting outside or whatever can now start to come in. The baby can come to you. You may be encouraged to start breastfeeding and all that, depending on how you feel, depending on your mood. Some people just feel so out of it. Some people are like, let me have my baby and let me just start breastfeeding immediately. So depending on how you feel, you definitely also want to let them know how you feel. So I think that's pretty much the whole procedure when it comes to cesarean section. Cesarean section is actually a major surgery, but in this case, yes, there is a baby involved, so most people don't really see it as a major surgery. And it's as good as, no matter the kind of birth you decide to use, whether you're doing a vaginal birth or you're doing a cesarean section, they are all beautiful. They are all a very good way of welcoming your child into the world. The only difference in the cesarean section is that you may need a little more help from people as against if you had a vaginal delivery, depending on individual as well. Now, after your cesarean section, when you're done with the bonding and everything, a few hours down the line, you start to feel sensation back on your legs and pain hits you, because of course you were cut open, layers of your skin were cut open, and you start to feel pain. It is also advised that you let your nurses or the doctor to know once you start to feel pain, because a good pain management is also very important, especially when it comes to recovery. So you want to also discuss that prior to the surgery with your doctors or the nurses, just before the surgery. Let them know that you do not want to feel any form of pain at all, because cesarean section is painful. Okay, it is painful. You have been cut open. Your uterus was cut open, your skin was cut open, your muscles were cut open. So it's actually a very painful procedure. I'm not even going to lie. It's a painful procedure once the medication leaves you. Once you start to feel your legs and everything, of course you're going to start to feel the pain. So let them know about your pain, and they're going to definitely give you something for the pain. So once you're hooked up to a very good pain relief, you may want to also start bonding with your baby, get as much rest as possible. The key to recovery, the main key to recovery from a cesarean section, is to become active as soon as possible. And by active, I mean actually get up from that bed and take a walk. Okay, so if, for example, you have your baby, let's say on a Friday, for example, you definitely would not want to get up on that Friday. You may want to lie down and still rest and everything, but it's advised that by the evening of Saturday, or at most Sunday morning, you should be up from that bed and you should start taking little walks. Okay, so the key to recovery from a cesarean section is that you actually get up and become active. Start taking little walks. When you're giving your pain medication and you're able to lift yourself up from the bed, decide on your own to start taking that walk. It's definitely going to help you with everything. It's going to help with the blood flow, is going to help with your recovery, is going to help prevent any form of embolus or blood clots or whatever. So yeah, that's basically it for a cesarean section, and it's a major surgery like I said, so you want to take things easy. In as much as, yes, I said get up from the bed and take a walk, I did not say go and start carrying things. You would need as much help as possible in the first 1 to 2 weeks after the procedure. So get as much help as possible, ask for as much help as you can. Don't think you can do things on your own right away. Once it's 2 to 3 weeks after your procedure, you can now start to do little things. But remember, you still had a major surgery, so it's advised that up till 6 weeks after your procedure, you still want to take things easy. Okay, so if you're a cesarean section mama, let me know in the comment section how your recovery was. This is basically it. This is the major things you need to know about the cesarean section.